Hi everyone, I'm Hannah Gilbard Johnson, they, them pronouns. I'll be talking about anorexia nervosa. So anorexia is essentially severe restriction of food, a belief that one is fat, and a significantly low body weight. So a really intense fear of gaining any weight, a belief that one is fat, even though typically very thin, and then, right, that restriction of calorie intake, the constant restriction of calorie intake. So as far as coding, the ICD-9-CM code for anorexia is 307.1, regardless of the subtype. I'm not going to go over all of the coding for all the subtypes. So there's the restricting type, which is basically just saying that the individual has engaged in a lot of restriction of calories, but is not binging or purging food as would happen with bulimia. There is also a binge eating or purging type of anorexia, which would include recurrent episodes of binging. It's important to know if the person is in partial or full remission. In terms of current severity of anorexia, so the BMI, there's lots of opinions about whether to use that, but currently the BMI is used to judge severity of anorexia. So for children, for example, a 17 kilograms of weight per meter of height, so 37 pounds per 1.6 feet of height would be considered severely underweight. And then it's 18.5 kilograms for adults, or 41 pounds per about 1.6 or 1.7 feet of height. Okay, so the diagnostic features, just to repeat a little bit, the persistent energy intake restriction, that intense fear of becoming fat, even if someone is quite thin, just the fear with certain body parts that one body part is too big. The critical thing with anorexia is the maintenance of a really, really thin body weight, as opposed to bulimia or some other eating disorders. Okay, continuing with the main criteria for anorexia, that really low weight, as I mentioned, the intense fear of gaining weight, and again, that body dysmorphia, one seeing, constantly checking mirrors and seeing in those mirrors that one is fat, even though that wouldn't be accurate under anorexia. Right, so, and just going back to that intense fear of losing weight for a minute, it's important that that fear is not alleviated by actually losing weight, right? Everybody in America has a relationship with food. Everybody in most places has a relationship with food. But in terms of anorexia, losing weight does not alleviate that fear of gaining weight if somebody is anorexic. It's important to keep in mind that an anorexic person will not normally take themselves to a hospital. They might take themselves to a hospital if there is a physical manifestation, another physical manifestation, and I'll get to that in a minute, because there are lots of other physical manifestations when somebody has lost so much weight, heart problems, all kinds of stuff. So they might take themselves to a hospital for that, but typically anorexia is going to be brought to professional attention by family members and not by the person actually suffering. It's really unusual that a person with anorexia would actually complain of weight loss because they really want the weight loss. Okay, so some associated features supporting the diagnosis. People with anorexia will often have depressive and anxious symptoms as well, related and unrelated to food. Often people who already had some obsessive compulsion or depression are more likely to develop anorexia. They're trying to control their lives by controlling their bodies, right? There are also typically a lot of concerns about eating in public, so that can kind of be related to the obsessive compulsion stuff that can come up as well. One note about gender: this is much, much more likely to be reported with people who identify as female. Now, plenty of men have eating disorders, but in terms of the reporting of eating disorders, that's about 10 to 1 female to male. Women are much more likely to be treated for anorexia. Okay, so moving on a little bit to risk and prognostic factors. Again, temperamental, people who develop anxiety disorders or obsessional traits are more likely to develop anorexia. Environmentally, in terms of occupations and avocations, right? So dancers, models, people in fields that might encourage thinness, are much more likely to develop that. A culture-related note that though pretty much everybody the world over has a relationship with food, people in socioeconomically higher status countries tend to be much more at risk. So the US, New Zealand, Australia, some European countries are much more likely to develop anorexia because we all have enough food to reject food. So we're more likely there. Okay, some diagnostic markers, some lab abnormalities that may be observed with anorexia. This is really important. Hematology, endocrine problems, bone mass problems. When somebody has lost that much weight, that's really affecting, their entire bodies, their resting energy expenditure. All kinds of physical signs and symptoms may happen with anorexia. A really common one is amenorrhea, right? The inability to have a period in women. And unfortunately, suicide risk does, of course, go up with anorexia, as well as the danger of substance abuse, alcohol and drug abuse, also very common. Okay, some things that should be considered really quickly. It's important to know that this is anorexia and not just those medical conditions, that it's not a gastrointestinal problem, that it's definitely that fear of losing weight, that it's not more appropriately diagnosed as depressive disorder or schizophrenia or a substance use disorder, that it's really focused on that weight loss. And it can be important to make sure it's not bulimia, that it's not focused on purging, but more focused on losing weight. Although, as I mentioned, there is a purging type of anorexia. Thank you very much for listening. All right.